As part of evaluating a potential adoption situation, Full Circle asks some very careful questions of expectant parents with regard to drugs and alcohol. The most important thing that we want expectant parents to know is that regardless of their history with drugs and alcohol, we have never once had a problem finding prospective adoptive families who would be open to their child. And this includes situations where a woman has unknowingly drank a lot of alcohol and the child faces the possibility of fetal alcohol effects or fetal alcohol syndrome. So we want to comfort them right away that there should be no reason to downplay, minimize, or lie about their history out of fear that there won't be a family that they can really have confidence in raising their child. When we ask expectant parents about drugs and alcohol, one of the things that is very important to Full Circle is to notice our own reactions that might include sadness that a child, a fetus, has been exposed to drugs or alcohol in utero, and not have that get in the way of our asking the important questions, the answers for which will be really critical to providing the proper care for the child and finding the right fit between the family and the child for the future. So when we talk with expectant parents, we try to minimize the shame. Sometimes people have drank alcohol or smoked pot or used other drugs before they knew they were pregnant. So we think that it's really important that people not withhold information out of embarrassment or shame. And then we ask the expectant parent to work with us. We're on the same side of the table here, because whatever information there is, it's ultimately going to be helpful for the child and the family. And so we might sit literally with a pregnancy wheel and figure out, based on when they're due, what the likely conception date was, and then work from that date forward, asking them, well, St. Patrick's Day was 2 weeks after that. Do you remember having a few extra drinks around St. Patrick's Day? Or New Year's happened there. Do you remember what you might have done to celebrate on New Year's? And in this way, we help piece together the history with the expectant parents so that we have a good picture of what exposure the child may have. I think that it has been a very common practice among adoption professionals to ask a question like, have you used any drugs or alcohol during the pregnancy? And that question is not likely to gather the incremental information that will be helpful both to doctors and medical professionals and also to the adoption professionals helping the expectant parents. In general, we ask that there be complete honesty and transparency, because that's the way we're going to be able to help them and be most useful to everybody involved. Having said this, I don't really see that many cases involving drugs like heroin or cocaine or methamphetamine. These are pretty unusual amongst the expectant parents with whom we've worked. If those arise, we work very carefully with them. We might get drug treatment records, in fact, and we assess the situation very carefully. I think more often than not, if there's been a substance that the fetus has been exposed to, it would be alcohol, and we take a very careful history with regard to that. Cigarettes is another matter. It's not an illegal drug, but it is certainly something that can affect the fetus, and we ask a woman about how many cigarettes that she tends to smoke on a low and a high basis so that we can have that information as well. In general, what we try to do is have as much data as is possible, and if we can decrease shame, ask small questions, and put aside our own feelings of potential worry for the child. If we can do that, then we are much more likely to get a true picture of the situation.